Hi, this is Dr. Doreste with the Cranial Release Technique, back with another video. It's going to be a short one today. Something interesting that came in via email. Before we get started, if you wouldn't mind liking, sharing, and subscribing to my YouTube channel. This way we can get the word out to more people throughout the planet so they can find out about the benefits of the Cranial Release Technique. I received an email from a chiropractor in the Atlanta area. Dr. John writes to me, "Hey, Dr. Doreste, what about the ease or difficulty of applying the cranial release technique?" So, as a practitioner, regardless of what type of practitioner you are, if you're putting your hands on people, we know that that can be very difficult physically for you as the practitioner. The chiropractor, the massage therapist, the physical therapist, the Eastern doctor, the acupuncturist that does body work, it can become a very physical, and it is a very physical job to do every day, every day, every day. The beauty about the cranial release technique, in theory, it is very gentle on the patient and also on the practitioner. So the way that I teach this to do is very simple in that what we're really trying to do, again, is to use the patient's own intracranial forces to open, align, and then to enhance this primary respiratory mechanism, which is happening in everyone. So even when you look at someone and you see that the eyes distorted, the ears distorted, the maxillary arch is distorted, you see distortion everywhere, understand that cranium is still going through the primary respiratory mechanism. It has to. If you're alive, this is happening, regardless of who you are, regardless of what age you are, regardless of what your diagnosis is or is not, this is happening. What we want, ideally, is to help the cranium and the body to open, unwind, and allow this breathing to maximize. That's the point of the whole work here in cranial release. So the technique is done very gently by the practitioner, and we always work on both sides of the patient's head because we want the head to be open, aligned, balanced, breathing from a three-dimensional standpoint. So I've done this to patients. If you've been in practice long enough, you've probably been called to someone's house where either they can't get out of bed, they're stuck on the floor, they can't get out of a chair, whatever. And I've done it in the bed, I've done it on the floor, I've done it in a chair, I've done it on a dining room table, I've done it on a kitchen table, a picnic table, in a car, on a car, at the beach, in a chair, in a wheelchair, in a dental chair, in all sorts of different scenarios, because the technique is exactly the same, regardless of you're talking about a newborn baby or a 90-year-old person sitting away with multiple issues. The technique is very gentle on the practitioner. So I've trained very elderly, frail practitioners, and they can do it. I taught a chiropractor who's in a wheelchair. She's doing it. So anyone out there can do it. It's not a matter of strength and physicality. It's a matter of finesse, understanding what we're doing, what we're attempting to doing, and at the bottom line, understanding it's the patient's body that's making the correction. It's the patient's body from inside out that's opening the cranium, aligning the cranium, and restoring the primary respiratory mechanism, restoring this breathing mechanism to the cranium, which is there in everyone, as we covered this morning, earlier today. So, again, the website, cranialrelease.com. If you're a practitioner and you'd like to learn more about this, you can click on the online training button and that'll take you to another set of videos and you can watch more about that. You can order a free report. You can find a practitioner in your area if you would like to experience cranial release. If you're not a practitioner and you'd like to experience it, you can click on the website, cranialrelease.com, find a practitioner, and hopefully there's someone in your area that is performing cranial release. And if there's not, maybe you can suggest to your chiropractor, your physical therapist, your acupuncturist, hey, check out this website, cranialrelease.com. See if this makes sense to you. I'd really like to receive this. And I think this 1 minute technique would help you in your practice, regardless of whatever else you're doing. Traditional chiropractic, very specific chiropractic, upper cervical chiropractic. There's many different techniques, as we know, in chiropractic. There's soft tissue, there's osseous type techniques, there's multiple techniques in the massage field, multiple in physical therapy, multiple in Eastern medicine. All of them would be enhanced by opening, aligning, and balancing the cranium. That's probably the main player that they're not looking at. Cranialrelease.com. This is Dr. Doreste signing off. Have a fabulous weekend, everyone. I wish you all the best. Adios, my friends. Goodbye.